Hello everyone, and welcome to today's presentation. I'm excited to have you here. Today, we'll be exploring the important topic of humidity and bland aerosol therapy in respiratory care. We'll look into how heat and moisture exchange work, the various humidification devices available, and what clinical implications these have for patient care. Over the next few slides, I'll guide you through these key concepts, so let's get started. Welcome to Chapter 39, where we'll explore humidity and bland aerosol therapy in respiratory care. Today, we'll focus on understanding the importance of humidity in managing respiratory therapy effectively. Humidity plays a crucial role in keeping airways moist, which helps prevent irritation and damage caused by dry gases. We'll look at how bland aerosol therapy is used to deliver humidity directly to the airway, especially in patients who need additional moisture support. Throughout this chapter, we'll connect these concepts to the overall goal of optimizing patient comfort and improving respiratory function. So, let's dive into the key principles behind humidity and bland aerosol therapy and see how they fit into comprehensive respiratory care. Let's talk about humidity therapy, specifically humidity and bland aerosol therapy in respiratory care. Humidity, as you know, is expressed in two main ways: absolute humidity and relative humidity. These measurements help us understand how much water vapor is present in the air or in a gas mixture. Absolute humidity is simply the actual amount of water vapor in a given volume of air, while relative humidity compares the current amount of water vapor to the maximum amount the air can hold at a specific temperature. Now, when we discuss types of humidity, we're really talking about water in its gaseous form, which we call water vapor. The amount of vapor depends heavily on temperature. Warmer air can hold more moisture, and cooler air holds less. So, what exactly is humidity? It's the presence of water in its gaseous or molecular form within the air or respiratory gases. This is crucial in respiratory care because the amount of water vapor affects patient comfort, airway health, and the effectiveness of therapy. Understanding how water vapor behaves and how to measure it helps us optimize therapy, ensuring the air or aerosol delivered is neither too dry nor too moist, which can be important for patient outcomes. Now, let's look at the physiologic control of heat and moisture exchange, especially in the context of humidity and bland aerosol therapy in respiratory care. The mucosa of the sinuses, trachea, and bronchi plays a crucial role here, helping to humidify the inspired gas much like the nasal passages do. The nasal mucosal lining stays moist thanks to several mechanisms. These include secretions from mucus glands and goblet cells, transudation of fluid through cell walls, and even condensation of the moisture we exhale. All these processes work together to maintain an optimal level of humidity in the respiratory system. When we breathe in, the nose heats and humidifies the incoming air, preparing it for the delicate tissues deeper in the lungs. Conversely, during exhalation, the nose cools the air and reclaims water from the exhaled gas, which helps conserve moisture and maintain balance. This primary function of heat and moisture exchange is mainly carried out by the upper respiratory tract, with the nose being the central player. The nose not only filters and warms the air, but also ensures that the gases reaching the lower respiratory structures are adequately humidified and warmed, which is essential for efficient gas exchange and overall respiratory health. As inspired gas enters the lungs, it quickly reaches what we call BTPS conditions, which stands for body temperature at 37 degrees Celsius, barometric pressure, and it's saturated with water vapor at 100% relative humidity. This means that by the time the air reaches the lungs, it's warmed and humidified to match the body's natural conditions. Normally, about 5 centimeters below the carina, the point where the trachea splits into the bronchi, we find what's called the isothermic saturation boundary, or ISB. This boundary is crucial because it marks the point in the respiratory tract where the inspired air becomes fully humidified and warmed to body temperature. Understanding this physiologic control is key because it helps us appreciate how the body naturally maintains optimal conditions for gas exchange. And it's also fundamental when we're considering interventions like humidity therapy or aerosol treatments, because knowing where and how this natural humidification occurs guides us in providing effective respiratory care. Let's take a closer look at how the physiologic control of heat and moisture exchange works, especially in the context of humidity and bland aerosol therapy. One key concept here is the location of the isothermic saturation boundary, or ISB, which shifts distally under certain conditions. For example, when a person breathes cold, dry air, the ISB moves further down the airway. Similarly, if the airway is bypassed, say with certain medical interventions, or if minute ventilation increases beyond normal levels, the ISB also shifts distally. Now, why does this matter? Well, below the ISB, the temperature and relative humidity of the inspired air stay pretty much constant. That means the airway's natural mechanisms are effectively maintaining humidity and warmth in that region. However, above the ISB, during both inspiration and expiration, the temperature and humidity levels fluctuate. This variation above the ISB is crucial because it influences how effectively the airway can humidify and warm the inspired air, especially in clinical settings where we might need to intervene with humidification therapy. Understanding where the ISB is and how it shifts helps us optimize respiratory care by ensuring the air reaching the lungs is adequately humidified, regardless of changes in breathing patterns or airway conditions. Let's talk about the physiologic control of heat and moisture exchange. Proper heat and humidity are crucial because they help ensure the normal function of our mucociliary transport system, which plays a vital role in clearing mucus and debris from the airways. During expiration, the heat and moisture from the exhaled air are actually recovered, which helps conserve the body's heat and moisture. This process means we don't lose too much of these vital elements with each breath. When we breathe in or inspire, the air is warmed and humidified before reaching the lower respiratory tract. This process is essential for maintaining the integrity of the airway tissues and supporting effective gas exchange. Now, shifts of the interface between the airway surface liquid and the airway lining, known as ISB shifts, can disrupt this delicate balance. Such shifts can compromise the body's normal heat and moisture exchange mechanisms, which can impact overall respiratory function. So, understanding these processes helps us appreciate the importance of maintaining proper humidity and temperature during respiratory care, especially in therapies involving aerosols or artificial humidification. Let's take a closer look at the moisture content in room air and how it changes as it moves through the respiratory tract. Starting with room air conditions, we see that at 22 degrees Celsius and 50% relative humidity, the moisture content is about 10 milligrams per liter. This is our baseline for ambient air. As this air is warmed and humidified, the isothermic saturation boundary plays a key role. At this point, the temperature reaches 37 degrees Celsius, and the humidity is 100% relative humidity, resulting in a moisture content of around 44 milligrams per liter. This is essentially the maximum moisture the air can hold at body temperature. Moving further into the respiratory tract, the trachea environment is slightly cooler at 35 degrees Celsius, but the humidity remains at 100% relative humidity. The moisture content here is approximately 40 milligrams per liter, which indicates that the air remains fully humidified but slightly cooler. Further down to the naso and oropharynx, the temperature drops to about 32 degrees Celsius, with humidity still high at 90% relative humidity. The moisture content decreases to roughly 31 milligrams per liter, reflecting the cooling and partial drying of the inhaled air as it passes through these areas. Overall, this progression highlights how inhaled air is warmed and humidified to match the body's internal environment, which is essential for protecting the respiratory tissues and ensuring effective gas exchange. Understanding these moisture gradients is crucial when considering gas conditioning and aerosol therapy in respiratory care. During inspiration, the diaphragm contracts and moves downward, which increases the volume of the thoracic cavity. This is a key part of how our lungs expand during breathing. When the thoracic cavity enlarges, it creates a negative pressure that allows the lungs to fill with air. Typically, the volume of air inspired with each breath is around 500 milliliters. This process is fundamental in respiratory care, especially when we're discussing humidity and aerosol therapy, because effective inspiration ensures that medications or humidified air reach the lungs properly. Understanding this mechanism helps us appreciate how vital proper airway management and therapy are for maintaining respiratory health. All right, let's talk about what happens during exhalation in a normal airway. When you breathe out, air is expelled from the lungs in a smooth and efficient way. This process is crucial because it allows for the proper exchange of gases, specifically oxygen and carbon dioxide, which is the foundation of effective respiration. In a healthy, normal airway, the exhalation rate is around 12 liters per minute. That might seem like a lot, but it's actually a normal, steady flow that our bodies rely on to keep everything balanced. Understanding this helps us appreciate the importance of maintaining airway health, especially when we're discussing therapies like humidity and aerosol treatments. These therapies support the airway's natural functions, making sure that exhalation continues to be efficient and that gas exchange remains optimal. So, in essence, a normal exhalation is all about smooth, effective airflow that keeps our respiratory system functioning properly. And that's why monitoring and supporting this process is so vital in respiratory care. Today, we're looking at the introduction of the endotracheal tube, or ETT. As you know, this is a critical component in respiratory care when we need to secure an airway. One key point to keep in mind is that heat can easily pass through the tube, which helps maintain warmth in the respiratory system. However, moisture does not pass through as readily, so we need to be mindful of humidity levels to prevent dryness and irritation. This distinction is important because it impacts how we manage humidity and aerosol therapy when an ETT is in place. By understanding that heat transfers more effectively than moisture, we can better tailor our interventions to ensure optimal patient comfort and safety during ventilation. When a patient is intubated, it's crucial to understand the impact on the airway and the importance of humidity and aerosol therapy. First, let's talk about what happens to the airway itself. When the airway is not properly humidified, the epithelium, which is the lining of the airway, can become damaged. This damage reduces the ciliary motility, meaning the tiny hair-like structures that help clear mucus and debris are less effective. As a result, mucus production actually increases, but the secretions tend to become inspissated or thickened, making clearance even more difficult. Now, because of this, the airway has to work harder to contribute to heat and moisture exchange. However, when cold, dry medical gases are delivered directly into the lower trachea and bronchi, they bypass the upper airway, which normally warms and humidifies the air we breathe. This delivery of dry gases can lead to further issues, as the upper airway defenses are bypassed. The endotracheal tube, or ETT, essentially bypasses these natural defenses, making the airway more vulnerable to damage and infection. So, maintaining proper humidity during intubation isn't just about comfort. It's about protecting the airway's structure and function and supporting the body's natural defenses. Now, let's take a closer look at the number 12, which is highlighted here as the central focus of this slide. This number actually represents a key numerical insight in the context of humidity and bland aerosol therapy in respiratory care. When we talk about this number, we're emphasizing its importance in understanding how certain parameters influence patient outcomes. In respiratory therapy, maintaining the right humidity levels is crucial, and the number 12 often relates to specific measurements or settings that optimize therapy effectiveness. For example, it might represent a target humidity level or a standard value used in clinical practice to ensure that aerosols are delivered effectively without causing discomfort or complications. Connecting this to the overall theme, understanding these key numerical insights helps us refine our approach to aerosol therapy, ensuring that patients receive the most appropriate and effective treatment. So, paying attention to these details, like the significance of the number 12, ultimately helps us improve patient care and outcomes in respiratory therapy. Let's take a closer look at the concept of relative humidity. It's calculated by taking the absolute humidity, which is the actual amount of water vapor in the air, dividing it by the air's maximum capacity at that temperature, and then multiplying by 100 to get a percentage. This formula helps us understand how much moisture the air holds relative to what it could hold at that specific temperature. Now, the ratio between the actual water in the gas and its maximum possible amount at that temperature is what we call relative humidity. Think of it as a percentage indicating how full the air is with moisture. When the air reaches 100%, it's fully saturated, and no more water vapor can be held without condensation. It's important to also understand absolute humidity, which simply measures the actual amount of water vapor present in a given volume of gas, and we usually measure this in milligrams per liter. Unlike relative humidity, absolute humidity isn't dependent on temperature. It just tells us the exact amount of moisture present. Connecting this to respiratory care, managing humidity levels is crucial for patient comfort and health, especially when administering humidified gases. Proper control ensures the air isn't too dry or too moist, helping to protect the respiratory tract and optimize therapy outcomes. In this slide, we're focusing on the physiologic control of heat and moisture exchange, specifically relating to humidity and bland aerosol therapy in respiratory care. The body's humidification system plays a crucial role here. It compensates for any moisture deficit that might occur when we breathe in dry air. This system ensures that the inspired air reaches full saturation at body temperature, which is vital for preventing dryness in the respiratory pathways. Now, how does it do this? Essentially, our body's humidity maintains proper moisture levels in the air we breathe in, which is essential for maintaining healthy respiratory function. We often express this humidity as a percentage relative to body temperature, with 44 milligrams per liter being the maximum water capacity at that temperature. When inspired air isn't fully saturated, the body automatically corrects this deficit through its humidification mechanisms. The humidity deficit is calculated as the difference between 44 mg/L, which is the capacity at body temperature, and the absolute humidity of the inspired air. Understanding this deficit is key, because it influences how much moisture the body needs to add to the air we breathe. Relative humidity at body temperature is expressed as a percentage, showing how saturated the air actually is compared to its maximum capacity. To determine body humidity, we take the absolute humidity and divide it by 44 mg/L, then multiply by 100. This gives us a clear picture of the moisture content in the inspired air relative to what the body can hold at that temperature. In summary, the body's own humidification system is essential for keeping our respiratory pathways moist and healthy, especially when the air we breathe is less humid than ideal. Now, let's look at some key indications for humidification therapy. One primary scenario is when a patient has high spontaneous minute volumes, specifically over 10 liters per minute. This means their breathing effort is quite significant, and providing adequate humidity helps prevent drying out the airways. Another important indication is when the patient's body temperature drops below 32 degrees Celsius. In such cases, addressing hypothermia is crucial because cold body temperatures can impair mucociliary function and overall respiratory health. We also consider patients with thick, copious, or bloody secretions. These require humidification to help loosen and clear the secretions more effectively, making it easier for the patient to expectorate and breathe comfortably. Now, a primary indication that we often focus on is when the upper airway is bypassed, such as during endotracheal intubation or mechanical ventilation. In these situations, the natural humidification process is bypassed, so we need to compensate for that humidity deficit. Lastly, humidifying dry medical gases, especially when flow rates are at or above 4 liters per minute in adults, is vital. Dry gases can irritate the airway and lead to complications if not properly humidified. All of these indications tie into our overall goal, ensuring the respiratory tract remains moist, functional, and protected to promote effective breathing and patient comfort. Let's take a closer look at the clinical signs and symptoms that can indicate inadequate airway humidification. When the airway isn't properly humidified, patients often experience a range of uncomfortable and potentially serious issues. For instance, they may complain of substernal pain and airway dryness, which can be quite distressing. This discomfort can lead to increased work of breathing, making it harder for patients to breathe comfortably and efficiently. Additionally, inadequate humidification is associated with a higher incidence of infections, as dry airways can impair mucociliary clearance and immune defenses. You'll also notice increased airway resistance, which can further complicate breathing efforts. Another common symptom is a dry, non-productive cough. Patients might be coughing, but not bringing up any mucus, which can be frustrating and unhelpful. In more severe cases, inadequate humidification can lead to atelectasis, or the collapse of parts of the lung, which reduces oxygen exchange and further complicates respiratory function. Recognizing these signs is crucial because they highlight the importance of proper humidity and aerosol therapy in respiratory care. Ensuring adequate humidification helps maintain airway integrity, reduces discomfort, and prevents complications, ultimately supporting better patient outcomes. Let's talk about humidity and dysfunction over time, particularly in the context of bland aerosol therapy in respiratory care. Initially, when a patient is first exposed to humidified air, we're seeing the beginning of that exposure to H2O at this stage. Humidity levels start to rise as the lungs begin to receive moisture, which is crucial for maintaining airway health. As exposure continues over a longer period, we enter what we call the long-term impact phase. During this time, humidity stabilizes at high levels, which can be beneficial, but also raises concerns about potential overhumidification and its effects. Now, at the midpoint of exposure, things become even more critical. The prolonged contact with humidified air causes humidity to reach levels that can be considered critical. That's where we need to carefully monitor and manage to prevent any adverse effects on the patient. Connecting this to the overall theme, understanding these stages helps us optimize respiratory therapy, providing enough humidity to support the patient without crossing into problematic levels that could cause dysfunction. Humidifiers are essential tools in respiratory care because they add moisture to dry gases, which is crucial for patient comfort and airway health. They ensure that the gas we deliver is properly saturated with water vapor, helping to prevent drying out of the respiratory passages. Typically, sterile water is used in these humidifiers to maintain a sterile environment and reduce the risk of infection. However, distilled water can also be used if sterile water isn't available. A humidifier works by adding molecular water to the gas. This process involves water evaporating from a surface into the gas, which is not yet fully saturated with water vapor. This evaporation increases the humidity of the gas, making it more compatible with the natural conditions of the respiratory system. Understanding this process is key to ensuring effective humidification and optimal patient care. Let's talk about how humidifier performance is influenced by several key factors, which are crucial in respiratory care. First, the amount of water in the humidifier plays a significant role. The more water it contains, the greater its thermal mass becomes, meaning it can hold and transfer more heat to the therapeutic gas. This is essential because better heat transfer improves humidity delivery. Next, there's the concept of thermal mass. The longer the gas stays in contact with the water, the more opportunity there is for evaporation to occur. So, increasing contact time can enhance humidity levels. Surface area is also important. The larger the area where water and gas are in contact, the more evaporation can take place. Think of it as more surface for water molecules to escape into the gas. And finally, temperature has a big impact. The higher the temperature of the gas, the more water vapor it can hold. This means that heating the gas can significantly increase its capacity to carry moisture, which is vital for effective humidification. All these factors, water amount, contact time, surface area, and temperature, interconnect to determine how well a humidifier can deliver the right humidity levels for respiratory therapy. Now, let's take a closer look at how reservoir temperature influences the humidity output in bubble-type humidifiers. On the left, we see unheated humidifiers, which rely on ambient temperature to generate humidity. Their performance can vary quite a bit depending on the room temperature, which makes them less predictable. On the right, we have heated humidifiers, which actively warm the water reservoir to increase the humidity output and maintain a more consistent level. This slide highlights the key difference in performance between these two types. Heated humidifiers are designed to deliver more reliable humidification, especially in cases where precise control is important for patient comfort and safety. Understanding these differences is crucial because it helps us choose the right device based on the patient's needs and the clinical situation. The overall goal is to ensure adequate humidification to prevent airway dryness and improve respiratory comfort, and knowing how reservoir temperature impacts this output is a vital part of that. Let's take a closer look at the 30-30 rule and how it relates to temperature and humidity in respiratory care. This rule helps us understand the vital connection between warming and cooling gases during aerosol therapy. When we warm the gas, its capacity to hold water vapor increases. For example, at higher temperatures, like 37 degrees Celsius, the gas can hold up to 44 mg per liter of water vapor. Conversely, cooling the gas reduces its ability to retain moisture. At lower temperatures, such as 21 degrees Celsius, the capacity drops to around 21 mg per liter. This is important because at 30 degrees Celsius, the maximum capacity of the gas to hold water vapor is approximately 30 mg per liter. So, understanding these temperature-related changes helps us optimize humidification during therapy. The key takeaway is that warming the gas enhances humidification, which is crucial for patient comfort and airway health, while cooling decreases moisture capacity. Recognizing this relationship allows us to better manage aerosol therapy and ensure effective humidification tailored to each patient's needs. Let's talk about the importance of operating at 30% capacity to prevent overloading. This rule is crucial because it helps us maintain system stability and avoid potential issues caused by overuse. Balancing temperature and capacity is key to ensuring our operations are sustainable in the long run. When we stick to these guidelines, we can optimize performance while reducing wear and tear on our equipment. Now, the 30-30 rule emphasizes maintaining a temperature of 30 degrees Celsius for optimal performance. This temperature control is vital because it directly impacts the longevity and efficiency of our systems. Keeping these parameters in check ensures we get the best results without risking damage or inefficiency. In summary, by carefully managing both capacity and temperature, we can achieve reliable and efficient respiratory care. These principles are fundamental for maintaining system health and delivering consistent patient care. Let's take a closer look at the different types of humidifiers used in respiratory care. Humidifiers are generally classified into two main categories: active and passive. This classification depends on how they function and their design features. When we talk about the design and performance specifications, these are guided by standards set by the International Organization for Standardization, or ISO. These standards help ensure consistency and safety across different devices. Now, passive humidifiers work by recycling the heat and humidity that the patient exhales. An example of this would be heat and moisture exchangers, or HMEs, which trap the patient's exhaled heat and moisture and use it to humidify the incoming air. On the other hand, active humidifiers actively add heat or water, or sometimes both, to the air delivered to the patient. These are devices like bubble humidifiers, passover humidifiers, nebulizers that deliver bland aerosols, and vaporizers. They actively increase the humidity level, which can be especially beneficial for patients requiring higher humidity. Understanding these differences helps us choose the right humidifier based on the patient's needs and the clinical situation. It's all about ensuring effective humidification while maintaining safety and comfort. Let's take a closer look at bubble humidifiers. These devices are designed to add moisture to the gases we deliver to patients, and they work by diffusing an underwater gas stream into tiny bubbles. This process helps increase the water vapor content in the gas, making it more humidified before it reaches the patient's airways. Now, it's important to note that these humidifiers are unheated, meaning they don't actively warm the water. Instead, they rely on the natural evaporation process to provide humidity. But there's a catch. When the flow rate of oxygen or air increases through the device, the humidity levels actually decrease. This is because higher flow rates reduce the contact time between the gas and the water, leading to less moisture being added. In terms of humidity output, these devices typically provide an absolute humidity of around 15 to 20 milligrams per liter. This range is generally sufficient for many clinical situations, especially when the goal is to maintain a certain level of humidity without additional heating. So, to sum up, bubble humidifiers work by diffusing gas into small bubbles underwater, which helps add moisture. Their humidity output is fairly consistent, but increasing the flow can reduce the humidity delivered. Understanding how these devices operate is key to ensuring effective respiratory care and maintaining patient comfort. Let's take a closer look at bubble humidifiers. As the slide indicates, there are several examples of these devices used in respiratory care. Bubble humidifiers are quite common because they effectively add moisture to the inspired air, which is essential for patient comfort and to prevent airway dryness. They work by bubbling air through water, creating humidified air that the patient then inhales. You'll find these devices frequently used with oxygen therapy, especially at lower flow rates. The key point here is that bubble humidifiers are simple, cost-effective, and reliable, making them a popular choice in many clinical settings. Understanding their applications and limitations helps us ensure optimal patient care, especially when managing humidity levels in respiratory therapy. Let's take a closer look at passover humidifiers. These devices are designed to add humidity to dry gases, and they do so by directing the gas over a water surface. One key point is that they separate water from the gas stream using a hydrophobic membrane. This membrane allows water vapor to pass through while preventing liquid water from entering the gas flow, which is crucial for safety and efficiency. Next, we have different types of passover humidifiers. The membrane type uses a special membrane material that facilitates water vapor transfer. The absorbent material type increases the surface area for the dry air to contact heated water, enhancing moisture transfer. This is particularly useful when you need more humidification. Then there's the wick type, which is often used with heated fluids during invasive mechanical ventilation or with room temperature fluids in devices like CPAP or BiPAP. The wick acts as a physical medium that wicks water and helps humidify the gas as it passes through. Finally, the simple reservoir type directly exposes gas to a water surface, making it straightforward and effective for certain applications. Overall, these different types of passover humidifiers are essential tools in respiratory care, helping to maintain proper humidity levels and improve patient comfort and safety during various respiratory therapies. Let's take a closer look at the various types of active humidifiers used in respiratory care. Bubble humidifiers, passover humidifiers, bland aerosol nebulizers, and vaporizers are the most common examples. These are all classified as active humidifiers because they actively add heat, water, or both to the gas before it reaches the patient. In contrast, passive humidifiers work differently. They recycle the exhaled heat and humidity from the patient, helping maintain moisture without adding heat or water directly. Now, focusing on active humidifiers, the HC150 stand-alone heated humidifier is a good example. It includes components like a flow meter, which connects to the mask or cannula, a sterile water and oxygen supply, and a hydrophobic membrane that ensures water doesn't enter the gas stream but allows humidification to occur. When we consider humidity levels, At a gas temperature of 10 degrees Celsius, the relative humidity can reach 100%, but the absolute humidity is only about 9.4 mg per liter. Increase the temperature to 40 degrees Celsius, and the gas can still reach 100% relative humidity, but the absolute humidity rises significantly to about 51 mg per liter. These devices heat water so that it expands into a vapor, which can then be inhaled by the patient. Simple room vaporizers have been used for years in outpatient settings, functioning as room humidifiers to add moisture to the air. Understanding how vaporizer humidifiers work is crucial. They heat water to produce a vapor that increases humidity in the inspired air, helping to prevent dryness and irritation in the respiratory passages. This mechanism is essential in managing various respiratory conditions, ensuring the patient's airway remains moist and functional. Now, let's talk about vaporized humidifiers. These devices work by heating water to the point where it turns into a gas or vapor. This process is essential because it allows us to add moisture to the air effectively. Simple room vaporizers have been around for quite some time, especially in ambulatory settings. They serve as room humidifiers, helping to increase humidity levels in the environment. This is particularly important in respiratory care, where maintaining proper humidity can improve patient comfort and aid in the management of airway conditions. By understanding how these devices work, heating water to produce vapor, we can better appreciate their role in creating a more comfortable and safer breathing environment. Overall, vaporized humidifiers are a straightforward yet vital component of humidification therapy, especially in settings where continuous moisture delivery is needed.